Good afternoon. Welcome back to Oneida Nation's Facebook Live. We're here on the Oneida Reservation in Wisconsin at our tribal headquarters, the Norbert Hill Center. We know some of you have heard some of this information before, so please be patient. We've got new viewers coming in all the time, and we just want to keep everybody up to date. And today we're going to be hearing from our medical update from Dr. Veer from the Oneida Community Health Center. With us we also have Patrick Pelky and Marlon Skenandore, who are going to talk about environmental health and resources and our food pantry. So with that, Dr. Veer, would you like to give us our update?
Sure. Thank you, Bobby. Sagoli, greetings everyone. As you know, Oneida declared a public health state of emergency on March 12th, which extends through May 12th of this year. The governor of Wisconsin declared the Safer at Home order on March 25th, which has been extended through May 26th. This week, the governor announced a Safer at Home transition to Badger Bounce Back plan. And this provides defined criteria on how we transition and phase out those restrictions in a defined manner. The intent of the Safer at Home plan was to reduce that surge of cases that would overwhelm our healthcare systems. And in many ways, it did accomplish that. We did not see the significant surge overwhelming our healthcare systems within the state, so we're fortunate for that. One of the questions that we get asked quite a bit is, when are we going to get back to normal? The short answer is it's not going to be easy, and we don't really have an exact date that we could predict. This decision will be driven by data, by science, and the situation on the ground. We are all familiar with what's going on within Brown County. As you recall, within a week, the positive cases within Brown County have gone up from 68 to 455. With the recent outbreaks that we've seen in the meatpacking plants in the city, contact tracing is ongoing and the number of cases is anticipated to increase. So we're going to have to adjust to this new reality and really continue with those safe distancing measures, universal masking or covering our face with some form of face covering, especially when we're out in public. I want to also give you a little update on what's going on with the COVID-19 status within Oneida. Within our jurisdiction in Oneida, we have 6 positives as of this morning, 3 in each counties, Brown and Outagamie. No deaths reported within our Oneida jurisdiction. The numbers may be subject to change with this ongoing contact tracing that's going on with the outbreaks, as you know, in the meatpacking plants in Brown County. Outagamie has 38 positives with 2 deaths, 455 positives in Brown County as of this morning with 2 deaths reported. Wisconsin has over 5,000 cases with 257 deaths. Our county, Brown County, is now the second highest, has the second highest cases in the state. Globally, we are reaching 2.7 million cases. In the United States, we're at 869 cases with almost 50,000 deaths. Within the IHS system, as of yesterday, we had a total of 1,915 positive cases, with the Navajo Nation being the most significantly impacted, over 1,455 cases as of yesterday. Phoenix, 158. Our region, that's Bemidji, Wisconsin, Minnesota, and Michigan, was at 19 cases. Another question that we get asked is our forecast for the spring and summer for COVID-19. Well, we are anticipating an increase in our capacity for testing in the very near future, and this is going to really help us in getting a better handle on the presence of the disease within our community. With the restrictions being looked at to be lifted based on data, we really need to look at things that have been successful in limiting the spread of this disease. So I really would like to emphasize again, keep safe distance of at least 6 feet from each other. use a mask or facial covering while in public. Stay home, and if you have to be outside, please practice safe distance, and stay home if you're not feeling well. Wash your hands with soap, and if you don't have soap available, use an alcohol-based sanitizer, and definitely keep that safe distance. I would now like to introduce our Environmental Health and Safety Division Director, Pat Pelky, who's going to be providing an update. Pat.
Yanko Dr. Veer Saguli. I'm here today just to kind of give you where we're at with our division. There's been a lot of changes within our division. We are now really looking at becoming an environmental health, safety, and agricultural land division. Basically, our focus areas will continue to be protection of the human health and in the environment. We will continue to manage and restoring our Oneida Nation and its natural resources, but we are working strongly of collaborating and cooperating with a food sovereignty and initiative and food distribution program, and we will continue to protect and manage Oneida land resources. So basically, our programs and services are set up to benefit the health and welfare of the Oneida Nation and its community through asserting sovereignty and also our self-governance programs. We are supporting the food sovereignty and safe food distribution. We'll continue to protect human health, the environment, and natural resources with the Oneida laws, established Oneida laws, and also federal laws. We also will continue to restore and manage our natural resources for sustainability, looking at soil health, water quality, animal health, plant vigor, and all related to the wellness of the Oneida Nation and community. We will continue to look at restoring our resources and also protecting our lands. We also will look at managing our land resources for additional revenue streams for the benefit of the organization and membership. We will continue to protect our Oneida land resources also through the trust and fee process, title, and probate services. We will continue to manage the Oneida Nation sacred burial grounds also. Some of the areas that fall under our division is the environmental and environmental health program. We also have our land management, which includes land management, conservation, and June Hinkle Farm. We also do the Oneida Integrated Food System, the Oneida Nation Farm, which is new, and the Oneida Nation Orchard, which is new to us too, just as a couple of weeks, and also the Oneida Cannery. So the most services that have been impacted by this pandemic basically has been the ability to have community workshops around gardening and food sovereignty education. We also are limited our farmers market. We're developing a social distancing protocol to put in place. We will probably just have food. Still more to come on that. We are challenging with tilling services and plants and seed and plant distribution. We plan on increasing those services, but we are also looking at increasing these protocols, social protocols, distancing protocols. Other things that may get delayed is our repair and our infrastructure improvements. We are pushing those back until there's a better financial sound system. We also looks like we will continue to look at all the things that we do and bring forth with what our focus areas. So under our food safety programs, for safety inspections will no longer happen due to the social distancing and facility closings. We did lose the sanitation trainee, and that was where we were developing capacity to do more of those type of work. We're also not doing the food handlers classes anymore, but we are doing online systems. Our air quality, we did lose some credentialed employees to assess our indoor air quality complaints, mold, asbestos, radon, and lead. We're unable to do non-emergency public health concerns, specifically within people's homes right now. Another area that was hit by the pandemic is that we did put our sustainable energy program on hold for now until things get better. Through our natural resources conservation programs, With the limited staff, we're not able to maintain the natural trails. We'll continue to do the hard surface trails. Our mulching and wood delivery for elders has been discontinued for now, but we're hoping to develop a volunteering systems with social distancing protocols in the future. Also, we are losing revenues from a hunting and fishing license. We're just trying to make those available free for the community. So some of the critical services you can still count on and available. We're still doing the food handling class. Will be done online. Emergency food handling facility inspections will be done on request. Right now our indoor air quality program, we're not doing anything for that because of the social distancing. Also for the food sovereignty and food security initiatives, we're still planning on doing a lot of things and looking at collaboration and cooperations, but direct contacts will be limited. But we are continuing to work on social distancing. Certainly the grass-fed beef will be available to the pantry. In the future, we also will have egg production. We're still not able to provide those community workshops for gardening and food sovereignty education, but we are working on still continuing the tilling service and the plants distribution. So conservation will continue to maintain the hard surface trails, and we'll be monitoring and patrolling to protecting our natural resources and our wildlife. Our land management leasing program will continue, and title and probate services. Our agricultural leases and commercial leases will still be available. Our title and trust and probate services will be available, but they will be limited. And also our agricultural and commercial maintenance services are also going to be there, but they'll also be limited due to resources. So our environmental compliance will continue to go with reviews that we do, our environmental reviews for land uses, our leases, our development projects. Stormwater compliance inspection will continue for the protection of water quality and soil health. Our underground storage tanks compliance will continue due to the gas station still running. Part of our, as we look at reopening and recovery plan, we'll look at the priorities of reopening through evaluation of prioritization of programs and positions for self-sufficiencies, public health enhancement and safety. We'll also look at continuing with our Oneida Nation land and natural resources to enhance the food sovereignty and the food initiative implementation. So we'll continue to work with monitoring and inspection of the swimming beaches and playground area as balancing with the social distancing protocols. So as those become more available, we will make sure that we get the protocols in place. We will continue to streamline the Oneida Nation and commercial leasing processes to increase revenues for land management and record keeping, and also for the lease requirements. We'll develop strategies to continue for the protection of our environment and lands through the Oneida Nation laws and other priorities. Part of this will also continue to provide internships, mentor training, and volunteering opportunities for our Oneida Nation membership to assist these services in implementing. So as we address the new normal, we will continue to look at all those specific areas. But in closing, I would just like to express our gratitude from the whole division is that we are very gratitude about letting us serve. We believe in what we do. We're very compassionate about it. We will continue to provide these services that you can expect in using our resources, efficiencies, and wisely. We'll continue to protect the health and safety and protection of the Oneida Nation members, and the reservation is a critical ensured our resources and protection of all. Thank you. Next, I would like to introduce Marlon, who's with our food pantry.
Thank you, Pat. Today I'll be talking about the food pantry and the resources that we have available. Also a couple other food resources that you can reach out, and kind of how we've approached this pandemic and changed some of our procedures. First off, I wanted to start off by just saying thank you to the community and our supporters. I wanted to start off by highlighting OSIPs, which is our Oneida Community Integrated Food Systems, which consists of ourselves, Jinhekwa, the Oneida Cannery, Oneida Nation Farms, Oneida Apple Orchard, the Oneida Food Service, Oneida Market, and aquaponics. All of these programs and services have offered some products or services past and present to us during this time, whether that's animals that were getting donated from the Oneida Nation Farm and Junhekwa, white corn from Junhekwa that's being processed at the cannery, lettuce from the aquaponics, and donated products from the Oneida Nation School System kitchens, and also the Oneida Market. I think it's a real testament to what the nation has built, and that we can pull together in a time like this. Some of the other places that have been real supportive of us or helped us in this time, bear with me, the list is kind of long. It's going to be Oneida Retail, the Elder Kitchen, the Head Start Kitchen. We got Bexme, various community members dropping off food donations and monetary donations. We got Hunger Task Force of Milwaukee, Hunger Relief Federation of Wisconsin, Radisson. All the restaurants, when the casino shut down, had donated all the food, all the leftover food that they had to us. The business committee's been very supportive. Various volunteers reaching out. We've had so many volunteers reach out that we can't actually have everybody volunteer due to the gatherings of 10 or more. Oneida Nation staff that had assisted. It's been very helpful and very supportive, and I think it shows a lot about our community. So the food pantry is one of the many food resources that we have available here. We also have food share, SNAP, or what some people refer to as food stamps. That's going to be available through economic support. They're located off West Point Road. If you do have any questions regarding the food stamps, I would definitely reach out to them. And in a time like this, everybody can use the extra assistance. Also, we have Oneida Food Distribution, which is located right next door to us. You can also follow up with them. I know there's a lot of people in the community that haven't had to reach out for assistance. So follow up with them, ask questions, and see what it takes to get the extra support. So just talk about a little bit about the pantry. We all know it's opened in January 2017. My time there, it's kind of become a place where families can come to when they fall through the cracks, when they don't qualify for other programs. We have a real easy application process that allows families to get food assistance, whether you have, if you got unforeseen circumstances or things that come up, whether you had car repairs, home repairs, those kinds of things. We're always going to be here for you when you need assistance, but this isn't meant to be a service that's used regularly. We ask that you, when you use the food pantry, that you only really come when you really need it. All your other options have been exhausted. If food stamps or commodities run out at the end of the month, then you can come see us. We'll be able to help you. So just want to highlight a lot of work goes into setting up the pantry weekly. Over the past 6 months, we've actually had an average of 165 hours of volunteer time, and the pantry really doesn't run without the volunteers that we have that assist us with the operations. So some of the procedural changes that we've made to follow the guidelines of social distancing, limiting contact, and hygiene. I'm going to kind of just talk through it as I kind of read out about how to utilize the services. So whenever you come, we're located at N7372 Water Circle Place. We're only allowing 2 people in at a time in a double set of doors. Which 2 things you want to bring is your tribal ID, and then also your proof of income, whether that's SSI, SSD, or maybe even a layoff or furlough letter, and that will just kind of determine your certification period. We have applications right there at the door. We also have applications online, and we'll put that website up later for everybody to be able to pull it out, print it out, and you can bring that right along with you just for ease of business. So the person at the front doors, the front desk, will kind of give you a rundown of how the operation is working. We ask that you kind of just follow through the protocols and kind of bring everything that's explained to you. If you do need services, we're open from 10 a.m. to 2 p.m. for distribution hours. This is when we have our volunteers and the extra staff on hand to help with all the families. If you do ever have any questions, we are available Monday through Friday, 8 to 4:30. That number is going to be 869-6165. If you have any questions, we're always returning messages that people need us as well. So what we provide you with is we provide 3 days worth of food for your family. This amount will be adjusted based off your household family size. The 3 days was adopted from how other pantries operate in the area. This could be possibly adjusted for more days as the pandemic progresses, but we'll continue to monitor that as we go. That could help with the limiting the travel and trips to grocery stores for some families. For elders and clients with disabilities, we currently don't have anything set up. If you need any kind of assistance, we just ask that you call. Like I said, number is 869-6165, and we can accommodate you in any which way that we can. Currently, we do have a lot of people that will pick up for elders. They call ahead, say they're going to send this person, and it's just easy as that. As long as we know, we can help you out in that way. There has been some discussion on deliveries for high-risk individuals. And we'll continue to assess that. We don't really have a plan in place for that, but as the pandemic progresses, we'll continue to monitor. Like I said, I just want to reiterate that we're here to assist, but not to rely on us as a continuous source of food. Use your options that are available to you, and only come to the pantry whenever it's really needed and you need that food assistance. Last thing I wanted to touch base with is, the community support has been absolutely amazing. And we'll continue to need that support as this progresses. Any kind of donations, if you want to volunteer, you can reach out. Right now our volunteer crew is pretty solid, but we can always keep you. I'm building a list right now of people that I may need that I can call, and I may be able to call on you when the need arises. And then lastly, the very last thing is just after the pandemic comes to an end and we can start to go back to normal, as they say, is to help with our Oneida food initiatives that we currently got going on. The pantry has a garden that we've been doing for 3 years now. They have community gardens at Genhequa, and Genhequa also uses help in the fall time. So if you can help out with the Oneida food initiatives in any which way, please do so. It will really help the community and help us be a little bit more sustainable and allow us to be able to feed our community when in need. Thank you.
Thank you, Marlon. And we're getting a few comments about a loud background noise. I believe it's my limo out back revving its engine up, waiting for me to finish up. But no, I'm just kidding. We don't know what it is. It may be something in our vents, the fans here, but we're kind of hearing that loud background noise as well, so we'll try to speak up a little better, a little louder for you all. We do have some questions that have been coming in, and thank you everybody so far, and it was great to hear everybody saluting the frontline workers, the managers. We've got retail workers, nurses, doctors, custodial people, our DPW grounds crew. We've got everybody from all over, all walks, who've been working and keeping our operations going and keeping us all safe as well. So we do want to also thank them as well. One of the things I'd like you to address, Dr. Veer, is there's a rumor or a misnomer about wiping off fresh produce in food with either your hand sanitizer or bleach when you bring it home from the grocery store?
Thank you, Bobby, for that question. No, I would not recommend doing any such cleaning. It's a good idea to eat fruits and vegetables. I think that's really a healthy thing to do. We got to keep ourselves physically, mentally, spiritually healthy in these times. So please do eat fresh fruits and vegetables every day, and wash them with just clean water, and that's plenty clean for most fruits and vegetables. There's really no recommendation to clean with bleach.
Thank you, Dr. Veer. What can you say, Dr. Veer, to those who are not taking this pandemic and the safer at home seriously?
Well, this is really not a short-term situation we're dealing with. We're dealing with something that is going to be going on for a few months to a year or longer in some shape or form. the only way we're going to really protect ourselves in the long term is to have either a treatment and or a vaccine for this condition. In the meanwhile, we do have a lot of things we can do to protect ourselves, our families, and our community. So I can't emphasize enough that we got to practice safer distancing. We got to use facial covering while in public. There is some anecdotal reports here when we're doing contact tracing for some of those positive cases or people that may have been exposed or high risk. We do contact tracing, so please do provide information to the public health staff that is asking you for that information. That's really critical to keep us safe, to keep the community safe, and your family safe. If there is a recommendation to stay at home, please do stay at home and not socialize with others, because that is potentially spreading that infection to your family, to your loved ones, and putting those individuals at risk. With some of those safe distancing and masking precautions, I do feel that we're not only protecting ourselves, but more importantly, we're protecting our families and our community.
Thank you, Dr. Veer. I also have another question about, let's see, the use of masks and whether or not that should be required, or how strong of enforcement can we get, not just for the Oneida Nation, but throughout, for the use of masks. You did address it earlier, but it came in as a question.
I think the masking, universal masking, is really a low risk, beneficial strategy for our community, for us probably as a state and nationally. There are communities out there that have masked, countries out there that have had universal masking, and they've really reduced the risk of spread. When we do the universal masking, it does not have to be a surgical mask like what I was using. It could be a cloth mask like what Patrick has. And the benefit really is, well, we are safe distancing right here, but the benefit of using the mask is a lot of our cases are asymptomatic, meaning people may have the virus and not have symptoms or not be sick. It may be pre-symptomatic, means they have the infection, they are not feeling sick yet. And those are the situations where a lot of these individuals are very infectious. So we can use a masking device or a face covering that'll prevent those infections from spreading to others. So we're really doing a service to ourselves and to our family and community by doing universal masking.
Thank you. I noticed there's a lot of questions about masks for elders. Where can you get them? Is anybody donating them? I think if you go on Facebook, a lot of people have offered to donate, and some volunteers, but we'll work on finding out if there's a central location where they can be donated and distributed to the elders. I would advise that most of you who are able to take care of your elders and get them a mask or make them a mask. There's a lot of easy do-it-yourself steps to making a mask, so it's not that difficult. Using an old t-shirt or a new t-shirt, or using some excess material somewhere. They're pretty easy to make, but if you really need them and can't find them anywhere, contact the 869-4481, and we'll see about getting a cache of some masks together that we can give away and distribute to the elders. Hopefully our elders are staying at home where they shouldn't need a mask, but if they do, I know some of them like to travel and go out for groceries, so we'll look into that for you. I have a couple of questions for Pat. Pat, where does our meat get processed, and do we have any concerns about our meat processing locations?
I don't believe so. It's a smaller processing facility. It's Beck's who does it for us, and it's scheduled, and we have not any concern of the past or present, and same with the future, but that's something we certainly can look into more to make sure they are doing that. So, but that's a good question. I think we could do a follow-up and just, it'd be a good time to double check. So.
Okay, great. Also, Pat, is there a reason that wood delivery has been halted? And another question that kind of goes with that is, tree trimming still available? Who should they call?
So right now, due to the limited resources of the tribe, we did have to make some very heartfelt, strong decisions around reducing some of these services. Right now, we are just maintaining, cutting the hazardous #1 classification that are more a danger to the health and assets of the elders and also the organization. The wood delivery pretty much is stopped now as we are finishing the season. Like I said in the presentation, we are looking to maybe look at a volunteering structure to maybe we could work with some community members to load them up and maybe they can do some delivery of mulch and things, wood chips, like we've done in the past. So we'll look into that, but those are the kind of the reason we're just down to limited staff and we're concentrating on the most hazardous trees.
And for Marlon, thank you, Pat. For Marlon, can you address the needs for off-reservation individuals who may need to use your services? What's available?
There's a lot of other pantries in the area. You'd be pretty surprised at how many pantries we actually have in the surrounding communities. Seymour has one, Black Creek has one. So people that are on the east side and have transportation issues, I know all the resources available, so I try to talk with them and let them know the resources. They might have a pantry right down the road and they have no clue. A majority of the pantries are in churches. Right now, I would just try to get you to those resources available, and if you could make the trip, it will be able to assist you. But as of right now, trying to get you to the closest resources available in your area is what I would try to do for you.
Thank you. Pat, is there any place or where can they contact right now for building permits?
You could probably, it's not within our division, but it's within Public Works, so you could call the Department of Public Works and they'll get you in contact with the zoning folks.
Okay. One more related is where can we haul tree trimmings?
Normally we can bring those over to the Conservation Field Office and we usually have set times when you can do that. I will actually work with the Natural Resource Director to get that online if we still are continuing that. Usually it's like one Saturday a month. So I'll go back and talk to the Natural Resource Director to see if that's a service we can get out there and still be able to do the same thing.
All right. Well, thank you. We've extended our time a little bit, but we're trying to take these questions as they come in. We're trying to make sure we address those concerns. And as always, we do post them up on our COVID website if we don't get to you in real time. So today we do want to thank you for watching and for your questions and for your supportive comments. We also want to encourage everybody, of course, the safer at home order is still in effect. We are beginning to lift things. When the state looked at lifting golf course prohibition, the Oneida Nation lifted theirs. Actually, it was lifted immediately as of Wednesday after the business committee meeting. So our Thornberry Creek at Oneida golf course is open for business and they're taking tee times online. We want to have continual Facebook Live events every Monday and Friday at noon. Seems to work well. They're being well received. We think we're getting a lot of information out to a lot of people. We hope you're sharing that information. Is there something that you'd like to see? Let us know. For the future coming up, we hope to get gaming management back in here, higher education, somebody from the schools to talk about graduation, end of the year, perhaps summer school, the programs, what our kids are doing right now and how that's going. We hope to get an emergency management, social services, and if there's other people that you'd like to see, please email us and let us know or enter in your comments on the Facebook Live. We want to say thank you to everybody. We know everybody's been offering the prayers. We've been keeping our statistics pretty flat. 6 has been tremendous, and so far everybody has been in recovery or is very, very close to recovery, so we're very thankful for those prayers that keep coming in. We'd like you to continue to engage and staying safe at home as Dr. Vera advised. keeping yourself safe keeps everybody else safe. So we hope you continue to be in harmony with all of humanity, and we thank you for your kind time. Have a great weekend.